If you or someone you know is sick, have tried to get help, and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today, 72 Queen Street, Kitty, or call us at 231-6477 for further information.
All right, a very good evening to all of you, my friends, family well wishers, those of you who are looking at us from abroad. Welcome to our program once again. It's Thursday, August 16, 2015, 2024.
I missed a day.
Thursday, August 15, 2024. Already the month is pretty much gone, and the year is almost gone. Welcome again to our program, and we're happy to have Dr. Richard here with us, as usual. Today we plan to have serious discussions regarding a few issues, which apparently are becoming major issues. One has to do with the coronavirus. Next one has to do with monkeypox. Dr. Richards has some information on monkeypox. Then we want to talk about cancer, because it is really, really becoming a major factor, and it's not very nice. What's happening is not very nice. So, Dr. Richard, welcome to our program. I know the clinic is closed at Georgetown, but we are still working on elsewhere. The folks in Guyana have deserve a break, and we do too, but I haven't had my break as yet. I just came back from Trinidad and Tobago. I'm heading now to Florida, and then to Jamaica and St. Martin. And all of those trips are work related. There's so many sick people all over the world. It's amazing when we find what is happening. Before we get started, Dr. Richard, I just want to welcome you again. And if you have anything you want to open with, you can go right ahead.
Yeah, thanks for the invite. Thank you so much. And thank you for being a listening audience to what we have to say today. Just today, I mean, the World Health Organization, the General Director General Tedros just made a public announcement, health emergency about the Mpox. So it's a health emergency, and it needs to be coordinated internationally. There's supposed to be an international response to it. And I don't want to be an alarmist, but that's how COVID started, with an emergency international announcement, basically, that they're finding this. They refer to it now as Mpox, which I think is monkeypox. There's some outbreaks in Africa and places like that. So get ready for an international response. So we know what happened the last time. So perhaps I hope not, that we're heading in the same direction as we did with the COVID, with the coronavirus. So that is new. That's just today. But there are other information that's out there too. They're talking about the COVID flirt. You heard now, we heard about long COVID, now it's COVID flirt.
Mm-hmm.
And, that's out there. And then there's a rise in dengue You know, dengue is out there and bird flu. So a lot of information, a lot of things are happening, and it's happening quick. And we just have to, be wise about what's happening and, you know, just act accordingly,
It's quite alarming that these agencies are releasing so much data all of a sudden, all at once. And only the other day, the EPA talked about the chemicals and banning chemicals which are used in the produce by farmers. Only the other day, this is August 7, that came out August 7.
Wow.
You know, we talk about these chemicals that we find in people all the time, and I think there are people who question what we find. I know that they do. But we don't find what is not in your body. We only find what is in your body. And when we see these things, and we mention it to people, they're alarmed and they're surprised and shocked. But the farmers know very well what they're putting in the produce. They know very well what they're spraying, and they just also stated that in the same report that it was realized that the chemicals that are sprayed on apples, you cannot wash them off.
Well,
yeah, you cannot rinse whatever you use to wash those fruits. The chemicals are not coming off.
Wow.
So they're suggesting that you peel the fruits. Now, how can you peel all of those fruits? There's some fruits that you just can't peel.
That's right. That's right. And then if it's in the skin, it's definitely going to be in.
The benefits are under the skin.
Yeah.
And if you peel the fruits, you have a better chance of removing some of those chemicals that are used by the farmers if you peel the fruits. But it doesn't guarantee that you'll get all of it either. You see, so we have things that are happening. And this is not to alarm the public in any way. It means information that's out there.
Yeah, it's just information. I mean, there should be a healthy set of maybe healthy paranoia. I mean, just question everything. Not to be fearful or anything like that, but just to question things.
We have to become more conscious of what we put in our mouths.
Yeah,
we have to become more conscious, because once it goes down there, your body absorbs pretty much what's in it. They say you are what you eat, but I don't agree with that. I say you are what is absorbed from what you eat. Because if you eat something and you get diarrhea immediately, that's going to go right through you.
Yeah.
But it's when you absorb it, then it becomes a factor in you. So I say you are a beneficiary of what is absorbed from what you eat.
Well, yeah, some people's system and the human body, especially with the gastrointestinal system, if it's very healthy, it absorbs whatever is put in there, sometimes immediately. People have like reactions. Some people are so sensitive that if they come in contact with certain things, they immediately have
immediately they get diarrhea, they puke, it brings it back out. It happens a lot to me when I eat certain things.
Yeah. Within
minutes.
Yeah.
I'm if it's not for me, I have to let it out somehow.
Yeah, but all of it. I was just thinking about what you were saying just now. It seems like the whole food source somehow getting tainted.
Yeah.
By every measure, and it really forces the idea of what you talked about a little while ago.
Over and over and over again. Grow your own foods. Grow your own foods. You cannot go wrong growing your own foods. You know what is in it. Yeah. You know where it came from. You know the safety of it. Grow your own foods. A lot of persons have started doing that.
Yeah.
I know that they have.
It's true.
But more persons need to do it, and then the farmers will get the message. You cannot have hardly anything organically grown except you put it in your own garden.
Yeah.
I was at a friend's house about 10 days ago, And he migrated from the US, ex-military, very high ranking. He's here, Guyanese. And he took us to show us, was myself and my friend Jeffrey. He took us to show us his garden at the back of his house. It's not a garden, it's a farm.
Wow.
It's that big. He is producing what he eats because he knows the dangers of what is out there. He knows the danger. So he is producing his own foods. Yes. He's producing his own foods. It's amazing.
That was wonderful.
So more persons need to grow their own foods. I'm saying that again. I'm just answering. I'm saying it again that the more we get back into growing our own, the safer our food sources will be. Because the farmers are really producing foods for the marketplace. That's what they're doing. We have several other issues that we want to talk about. And one has to do with a major factor. You know, only today I got a text and then a call from someone I screened in St. Martin on my last visit. The last couple of persons I screened was the husband and wife. I screened the wife and we found issues, but the husband felt that he had no issues. So when I screened him, I found major issues in him, but he denied to accept what was found because he wasn't feeling any symptoms of any kind. So he felt that he's okay. Well, today I received a call and the wife was all alarmed because he was admitted to hospital last night. Emergency. Right? I haven't called her back yet. I didn't want to really want to say I told you so. You know, it's not the time for that.
No.
But I remembered him denying the fact that number one, he had hypertension. Number two, he had two heart valves that were pretty much clogged. He had plaque in his arteries, but he wasn't feeling any symptoms. Well, he went into cardiac arrest last night.
Wow.
See, in denial, Dr. Richard. How many persons, when we screen them and we find, you see, the problem that we have with persons is that the device is an early detection device. And it also is a device that detects what's happening to you now. If you have situations that can occur in the future because we have the modules that we can click on that will tell us if we don't do something in 1 year, 5 years, 10 years, what can happen. When we go on those modules, we can see, listen, if you don't do something about this thing now, it says within 1 year. Within 1 year means that it can happen at any time.
Within the very same year.
Within the same year, maybe the same month. You see? So he failed to acknowledge that, and strange enough, not nice, he had cardiac arrest last night.
Wow.
Yeah, and this I saw him about 3 months ago.
Oh, wow. He had a long time to do something about it.
He had enough time. He had enough time.
Did he follow up with the recommendation?
Well, that is what I want to know, if he did or not. But knowing the person I was dealing with, because he had no symptoms, he probably didn't feel it wasn't, you know.
Yeah.
You see, he didn't think it was necessary.
Yeah.
See?
It's a funny thing, you know, it's not really funny, but our bodies we're so wonderfully and fearfully made that you can have a problem in your system, in any system, but all the other system, you know, it compensates
Mm-hmm.
you know, just to make you, just to get you at the level so you're functional, you know. But eventually, you know, one system is compromised, then the other systems are compensating, then eventually another system may go out, you know, and eventually, you know, you succumb to whatever the problem is that you were being compensated for, you know. It's the system really gives us forewarning, you know,
Yeah.
way ahead.
It does.
So that if somebody really believes, and like you know, I say a lot of people don't really, some people, and I shouldn't say a lot, because a lot do believe. A lot of people, some people don't really believe that this thing is for real,
Mm-hmm.
you know, until they experience what it is that you're telling them they were heading towards, you know. And until then, you know, they want to put the recommendations into play. Sometimes it may work and sometimes it may not.
Sometimes it's too late.
It's too late, you know.
You know, so my when I got the phone call and I saw the message, immediately I remembered what I saw, what I said to him.
Mm.
And I said to him, I said, boy, if you don't do something about this right now, chances are you're going to have a problem very soon. I did. I said that to him. And his wife was sitting right there.
Yeah. So a month went by and nothing happened. He says, well, I don't know what he's talking about.
Yeah.
2 months been by, I'm like, I'm okay.
Yeah.
The third month come and
Boom.
Yeah.
Mm-hmm.
So, you
Yes.
know, if people want to play like that, I mean, that was his choice. And
You
we
see,
by no means can force anybody to follow anything, you know.
the situation is the device that we have is not what people think it is. Some people see it and they think it's it's so simple, it can't be real, you know.
Mm.
Some people know that it's real because they've experienced problems and they've gone everywhere before and they
Yeah.
couldn't get answers. So they know that, listen, if you find that in me, then it must be that, because they didn't find it in me.
Yeah.
You know. So we have those people who are convinced of the findings because they've experienced no answers where they went. Those are the ones that we get the best results from, because they follow what they have to follow, because now they know they have no place else to go.
Yeah, and they come with a history of knowing that they have won everywhere.
Yes.
And then not only do they come to us, but we're telling them, we're able to see what it is that they're experiencing, and they say, yeah, and they never even tell you about it. You know.
Yeah.
So, and they're, you know, that in itself, you know, convinces them that, hey, you know, you are able to really show me what I've been experiencing. And when I said this to other people, they didn't understand what I was saying, or they weren't able to tell me, like you're telling me, you know. And you know, it's I appreciate patients like that, because
Yes.
you know, it's
because you know they're gonna do what it takes.
yeah. You know,
they're gonna do what it takes. Anyhow, I just thought I'd mention that because it's live, it's happening now.
Yeah.
And it's a clear example of the early detection, which gives you time to make adjustments, to make changes. And the fact that you don't make those changes, and then here's the result.
Yeah.
You know, the doctors told him, the wife told me that on the phone, and they called me from St. Martin. She called me, I was driving coming down to town. And she said, Dr. Haynes, the doctor said to me that if he didn't get here on time, we would have lost him.
Mm.
Yeah.
Mm.
Right now he's in ICU.
Wow.
In St. Martin.
And the battle has not ended.
It's not.
It's still there. So, you know, prevention is better than cure anytime. And if and there are a lot of very wise people, they realize uh, what we're doing, and they don't have to wait to have or experience anything. They come and check things out. And,
Yeah.
I like those too because, they're way ahead. You're able to see exactly where things are going and turn the thing around. That's prevention. Preventative medicine is always best.
Always best.
It's always best. I screened this week. Actually, it's a review of one of your patients, and then he said to me that everything that you had told him was true. He just came from the cardiologist, and what the cardiologist told him is what you already had told him several months before. And no, I'm sorry, it's not a cardiologist. The oncologist.
Yeah.
That's the wrong doctor. I'm thinking the heart still. You still got me with the heart there. Still thinking about your patient. Yeah, the oncologist had told him what you had told him a while ago, and he just came from the hospital and just remembered and said he's going to stop by without any appointment or anything just to verify what was going on. And yes, he did have some cancer cells, but not in the place that they had found it. Their cancer cells were in other places. And what he told me is what really I brought this situation up now to mention is that because I asked him, I said, "Were you vaccinated?" He said he was, and then he told me the story. He said, it was a group of us, I think 5 or 6 of them, who decided to go and get the shot. They all went. And he said, of the group, everyone came down with cancer.
Wow.
Everyone came down with cancer. One person who recommended him to you, the person who he died actually recently of, I think it was prostate cancer. Just a few weeks ago, prostate cancer. So I was like, my question to him was, I said, everybody? He said, yes, everybody have cancer. Everybody have cancer. So what does that tell you? It's very, very alarming.
The next matter that we were going to discuss is cancer, because for some reason it is becoming like an epidemic.
Yeah. A lot of cases.
We are seeing more people now with cancer than ever. And I am, we don't want to say 100% that is from the process that occurred during the COVID time, but all roads are leading there. Because when you talk to persons, they're saying, but I was fine before that.
Yeah.
Before I took the vaccine, nothing was wrong with me. Before, there's so many people who would have died already, gone, that family members were saying, but nothing was wrong with them before that. Everything was fine. I mean, but all of a sudden, when they took the vaccine, they got sick. The mold got twisted. They started having problems with clots and all sorts of things. And I don't know, Dr. Richard, I'm not sure. I'm not sure what really to say about this situation. I really don't know.
Yeah, I mean, there's so many studies now, and they're putting there's a correlation between the two. They're finding that, and I mean, I know what I see every time, and I purposely inquire, whether or not they were vaccinated or not, and most of the time, most people were, they get a shot, and it's very, very alarming, and some people are coming down with stage 4. Sometimes when they realize there's a problem and they go and check it out with the oncologist, is that it's already been there for a long time, and then you try to do something to help them, and it just throws the system off. It's very difficult, stage 4. A lot of times.
Yeah.
and that's the problem we're experiencing. Sometimes they don't even know at what stages they are before they come to you. They can't tell you because they just had it. But I mean, we've treated all sorts of stages before, but it's a battle. It's a big battle, and there's nothing we can, like the young man told me. He says, I wish I can reverse all of it. I can't do anything about it now, But everybody that took the shot, he was telling me, even a young lady with breast cancer and things like that, and that's a sad thing,
But what can be done? I mean, it's what I encourage people to do. I encourage them to do everything they can to get their immune system functioning optimum.
Yeah,
that is what I do, to get the antioxidants that are required.
Right.
Cut off the dead as much as you can, because a lot of people are eating a lot of dead. They're using a lot of seafoods. They're using a lot of animal products, and the chicken is loaded with chemical hormones, and what they're doing is actually overloading the body system.
Yeah.
And then they have the situation where they're trying to fight those viruses, which are enormous, from the vaccine. We are blessed to see what is in them. We can see what's in those vaccines, but most persons don't have no idea of what's in those vaccines.
There's
you see, so the body system is under attack 24/7. And if you continue to eat foods that are lacking nutrients and that are chemicalized and are full of steroids and hormones, and your body is already under stress trying to ward off the effects of all those viruses that are being dumped on your system, then you have a body system that's under duress and under stress and fatigued. And those organs are going to conk out or fail sooner or later because they're tired.
Yeah. Unfortunately, that's what it is. And sometimes the more you try to help, is the more sometimes they've been fighting for so long. I mean, you get tired. All the organs are constantly under attack.
That's the reason why we have so much organ failure.
Yeah.
There's so much organ failure, and the other thing that persons are doing, they're eating a lot of not only dead matter, but they're eating a lot of fried foods, a lot of fats. And some people say, well, they don't fry anything, but then you're eating pastries, you're eating cakes, you're eating breads. All of those things have fats in them.
Yeah.
And besides that, you can hardly ever get all the fat off the flesh when you eat it. You see, so it's an enormous battle that the body has continuously trying to ward off and overcome. And then people don't exercise hardly. The average person does not exercise.
That's a problem. You don't sweat, you don't do anything.
So you're not burning anything. You're not actually, and besides that, many persons don't cleanse their system. They're not detoxifying. So your body accumulates all the garbage, all the chemicals, all the fats, all the waste, and then you're not getting rid of the waste. So you keep reabsorbing into your system all of that waste over and over and over. Then you got to deal with all the viruses that you've been injected because of somebody who felt that you needed to get something that your body could have overcome anyway. I keep saying to people, coronavirus has been here. It's not going anywhere. It's going to be here with us until the end of time.
Yep, it's there.
Now they talk about Mpox, right? What is Mpox? Mpox is monkeypox.
Yeah.
There's no sense you hide it and try to abbreviate it. It's monkeypox.
Yeah.
Where did it come? Where did that come from now? It's all part of the onslaught that is being dumped into the system to get people sick.
Yeah. I always, my question is, when these things break out of the scene, when it says this is coming, I'm asking, well, where is it now? Where was it before it started coming? Where is it coming from? You know, who is letting it go? Where is it coming from? You know, and it's really an attack. You know, it's attacking the health. And this mpox, this monkeypox, the last time they talked about it was a year ago. And what they were saying is that it was more in the homosexual population.
Yeah.
Yeah. And what they're saying now is that if this disease, this monkeypox, it can be caught by just contact. You know, it's contact. It's a contact sort of. That's how it spreads, by contact. So if you see somebody with a whole lot of sores in their hands or in the skin and things like that, you know, you either in the palms of their hand and you shake their hand, then more likely you can get it, you know, or you touch their skin, or you know, it's from contact to contact, you know, skin to skin. So we have to be, you know, a little bit more.
But you can also get the papillomavirus that way.
Oh yeah, of course.
You shake somebody's hand with papillomavirus, you can pick it up too if you don't wash your hands properly.
Yeah, viruses are like that. You know, viruses are like that. Well, what they're trying to tell you is that, you know, just be a little bit more observant. You know,
which is important.
Yeah, it's not a bad
we need to be more observant. We need to be more careful.
Yeah,
I say to people, also, Dr. Richard, wear your mask. The mask is not only to protect you from coronavirus, it's not only to protect you from dust, it's to protect you from anything that's in the air. We got people out there who got bronchitis, tuberculosis, pneumonia, streptococcus. You know, I mean, the mask is not 100% guaranteed, but it will at least give you some protection. You know, but your immune system, the key factor there is your immune system.
Exactly.
You have to build a strong immune system. You got to get into your antioxidants, get into your D3, get into your lysine, get into your vitamin C, you know, 1,000 milligrams every day. You know, your children need also to be boosted up, because when the children go to school, and school is getting ready to open here soon, it's already open in by you there. When the children go to school, they're in the midst of other children who have conditions that you don't know.
Yeah.
For instance, many of the children spread the virus that's called adenovirus. Okay, we find that to be one that is very common in school amongst little children.
Oh yeah,
and then they bring it home and spread it. You know. So,
yeah, that's right.
So what parents need to do also with the children is teach them to be very serious about sanitizing.
Yeah.
Teach them that it's important to wash their hands before they pick up anything to eat.
And they go, you know, I know a lot of times, especially young kids, the reason why this adenovirus and then Kingella, so it's spread from child to child. It's because, you know, sometimes they have the kids go to the restrooms, and it's an oral fecal sort of virus.
Exactly.
And then
they don't wash their hands properly.
They don't wash their hands, no. And, you know, the kids come back and they're touching this and they're touching that and touching each other, playing, you know. And, of course, those particular viruses are very, very detrimental to the elderly.
They're contagious, and they can be transmitted, and they can create issues. They deteriorate your immune system, which is already under stress. So when you have a weak immune system, it's like a football game. If your defense is weak, everything is going to penetrate.
Oh, yeah.
You know, if you're boxing and your defense is weak, you're going to be knocked down on the canvas.
There you go.
Sooner or later, you're going to be knocked out. You know, you can't, because your defense is your strongest offense.
That's right.
You know, so it is important that instead of buying sweet drinks or sodas and putting it in your children's lunch kit, you make the juices and use vitamin C to enhance their immune system. That way they're drinking something healthy. You get a vitamin C liquid or tonic, you give them every day before they go to school to help them to have an immune system that is strong to protect them. You know, you give them their multivitamin, multimineral tonics. You build the children, because the foods that we're eating today don't have those nutrients that it used to have years ago.
Right.
They don't.
Yeah. Yeah. Yeah.
You know,
No,
so
a lot of these viruses, though, they're the ones that are attacking us at this present time. The coronavirus and the COVID flirt and the mpox and all these things. A lot of these are RNA viruses, and what they recommend, it's exactly what you're saying, and they're also saying is that zinc is important. A lot of these viruses succumb to zinc. The thing about zinc, though, is that zinc of itself cannot go through into the cell. You need cortisone, you need elderberry and things like that. Ivermectin, for example, and hydroxychloroquine, and all those things help to open in the cell the zinc channel so that the zinc can go in. And once the zinc gets into the cell, that's what helps you to get rid of the virus, and then also to help to build an immune system. Right.
Yeah. Yeah.
Oh, zinc is important, but you gotta, use get something to open up the zinc channel in the cell, and it's very, very important that you get. I think they talked about elderberry and they talk about
But the only thing about the berries, Dr. Richard, the only thing about the berries is that when we screen persons, we see that sometimes that they have resistance to certain berries.
Oh, okay, yeah.
We see that. So even though those are all good, they may not be all good for everyone.
For everybody, that's right.
Right. So what we normally recommend, and you recommend it also, is that they stay on the things that pretty much everyone can handle, like the vitamin C, right? Like the lysine, the D3. Most persons, if not everyone, can take those, and they shouldn't be able to have any problems overcoming those viruses. But the other thing that is very important is that you need to make sure that the sources are good, because a lot of people out there have those nutrients that we mentioned out there, and they're not genuine. They're synthetic. They're not real. They're not natural. So the body doesn't absorb them.
Yeah, it's true.
You see, there's so many complications that are linked to what we're trying to get people to do. I mean, some people get frustrated. So, well, what am I going to do? What am I going to do? You need to find a source that is natural. Like the clinic here, we make sure we carry products that are natural that you can absorb. And then we have maybe a few others that do that. But if you buy the chemically made products, then you're in trouble because you're not going to absorb them.
Yeah, the synthetic is, we are organic in nature, and that's inorganic stuff is not good. So you need to get something very similar to be able to assimilate in your own body. Plant products are very good for that.
Yeah.
But yeah, it's a
serious dilemma that the human race is in, and we have to find solutions, because we're losing too many people too often, too soon. Too many people are just falling out, and some persons, they're saying that, but he was okay, everything was fine until he took the vaccine. So what is it that's in the vaccine that is triggering off all of this response in people that's negative? Something is wrong, and everything that was being said that was mentioned about it being, it's conspiracy theory. It's all conspiracy theory. I mean, look what's happening now. It's all coming back to haunt us.
Yeah.
All those persons who were talking about conspiracy, they're quiet now. You're not hearing anything from them.
A lot of them have died.
But that's another thing.
The people who, I met a man who was saying the same thing, and then before I know it, I saw him 1 week, and 2 weeks later, he was dead.
History.
And they went and got this booster and that booster and all the boosters, and then they become a rocket, went out of space. It's ridiculous. So it's we're in a dilemma here.
Yeah.
It's sad because you get to meet people and you try to help them, and then next thing you know that they're dead. You
Yeah.
know, they're not able to, and then they took the vaccine, and you see all these things inside of them, and we can see everything.
That is the beauty about the device that we have, and I keep saying it over and over, is that we can see what's in people, but the people themselves, many of them don't believe what we see.
Yeah.
People need to start believing and start doing things that can counteract what we see.
Mhm.
Like changing the diet for sure. I I can't help but mention the part that we have the most trouble with. People say that I don't know what to eat. I don't know what to eat.
Mhm.
Doctor, what am I going to eat? Well, when I was in Trinidad, I had a little bit of time, and one of the patients decided to I wanted to go to the market. So I went to the market Sunday morning. And Dr. Richard, everything that you need was in the market.
Wow.
Everything. And most of it is grown right there. Most of it is grown right there.
I hope they didn't spray them and all that stuff.
Well, many of the persons that are in the market, I understand, they grow things organically.
Oh, okay.
But I don't know, again, we don't know how true that is in many instances. But
Yeah.
but I know that the foods are all there.
Mm.
So I got a call from one of the patients, says, but Dr. Haynes, I know it's my body that's saying this, but what am I going to eat? I says, well, you can't tell me anymore that you can't find food to eat, because I went to your market and I saw in the market that you have your market. So many things that you can eat. It's all in your market. So don't tell me that you can't find things to eat. I went to your market, and that was it. That was it. That was the end of the conversation. So
Yeah.
people need to understand that when we go down that list of foods that the body is saying you need to avoid, it's not because we want to put you on a diet. It's because of the body system saying to you that at this time, these foods are contributing to your problem. Come off of them for now.
Yeah.
That is what it means. So don't cry about what you can't eat. Find alternatives that your body can use to give it nutrients to overcome what is wrong with you. Because that list of products is saying to your body, I am part of what's affecting you. So you need to come off of me.
That's right. But some people they don't feel like they eat until they have a piece of chicken or a piece of pork or a piece of fish, piece of steak.
Yeah.
Where's the beef? The old lady used to say, where's the beef? So a lot of times, when the body tells them that these things are affecting them, they figure once the meat is out of the equation, then there's no food. You remember when people used to eat, some people you eat when they will eat everything else and leave the meat for last. That was
Yeah. That used to happen in our home.
Yeah. That's the highlight of your dinner, So, it's the same with people here, most people, not everybody, but a lot of them who, and I find the ones that are questioning the diet, many a times they're really missing the meat. When you tell them the next thing they say, well, where am I going to get my protein from?
Yeah.
Where am I going to get my protein from? So,
well, I did some research on that some time ago, long time ago now. And I realized that everything has protein inside.
Yeah.
Everything. It's just it may not have as much as another.
And the thing is, the protein, what your body really cares about is the amino acids, because
Exactly.
You got to break down that chunk of meat into an acid, amino acid. so that the body can utilize it. So plants have amino acids, you know.
Well, I started to ask the question because it was revealed to me in a vision, not a dream. It was a vision because I was alert. The question was asked in the vision, what is it that you could absorb from something that's dead?
Mm.
What living matter can you absorb from something that's dead? I thought I was dreaming, but I was awake. I was alert. I was in my bed, 2 o'clock in the morning. So I said, who are you? I mean, how did you get in here?
Mm.
You know, it was a voice, and I answered, and the voice repeated itself again. Seriously. What is it that you can absorb from something that is dead?
Mm.
And the answer came also.
Dead?
Nothing. It's already dead.
Mm.
So what living matter can you absorb from something that's dead? That is the question I'm asking now. And I wish that somebody can answer it for me, because my answer is I'm getting is nothing. What living matter can you absorb from something that's dead? It's already dead. So there's nothing living in it.
Well, you know, nutrients. Well, you can get a bacteria or a virus. From a dead thing.
You can get
you can get a
E.
lot.
coli bacteria. You can get all
that's
sorts of things
the worms
which are harmful.
The worms are living too.
You can get worms.
Yeah.
You can get worms.
In certain climates, certain animals, I mean, they're not even quite dead for 24 hours, and you can see worms start moving inside of them.
Exactly. Because the larva is in them.
It's in them, exactly.
The larva is there.
Those are things, those are alive, you know, waiting for
You
the
can get that.
Yeah.
But what good would it do you?
No good, it would do bad.
Oh man, if only, you know, I think we are fooled and we're brainwashed to believe a lot of things that really isn't so.
Yeah, that's true.
You know,
we have to change.
The plants that we are made to eat and consume will have, if grown properly, pretty much everything we need.
Mm-hmm.
You know, because our bodies are designed to utilize those, but it has to be grown correctly.
Right.
We have to stop using all those chemicals, and like I stated to you the findings which they came up with, and now we're asking people to peel things. You know, how could you peel callaloo?
No.
How can you peel pak choy? You can't.
And you know, I believe a lot of times these things are purposely done so that the food source can be tainted. You know, there's an objective to all this.
But that's a sad thing.
Yeah.
Because it's to the detriment of the human race.
Yeah. Yeah. It's a very evil intent. Very evil intent. That's all I can say about that. But you know, the thing is, I'm thinking as we speak about this new
Mpox
emergency broadcast, and that needs a coordinated international response. The last time that coordinated international response was in play.
Was the
lockdown. I'm sensing that maybe we're heading in that direction very soon. And I'm not trying to be an alarmist or anything like that, but we have to so quickly we forget, you know, from whence we came. And it was a few years back around, 2019 is when coronavirus was all over the other places in the world. People were saying, well, we're looking in the news and we're seeing people with masks. Why are they wearing that? Why are they wearing masks?
Mm-hmm.
Oh, what's the... Not knowing that it will be coming very soon to us. So it's the same sort of...
same scenario?
yeah, same scenario playing out before us. In another few months, who knows what we're going to be having to experience. And I remember and I recall in 2019, I was seeing people lining up at stores. I'm like, what are they doing that for? Well, they're talking about something coming here just to get toilet paper. You remember seeing all
Right.
that?
Yeah, I remember that. Yeah. Yeah.
And some people were there early and getting food. I'm like, why are you doing that for? Well, don't you look at the news? They're having, it might be coming here soon. What? So, it starts, there's little tricklings of similar things or
But it was said some time ago that there's going to be another epidemic.
yeah, they said it.
It
And
was said some time ago that it's
yeah,
coming.
they said it's coming. Like I said earlier, my answer to that is, well, where is it now? And who's letting it go? And where is it coming from?
Well, we know that China got blamed the last one. They
Yeah.
got blamed for the last one, so maybe they blame Africa. Maybe they're going to blame Africa this time.
Who knows? But they're saying very quiet, loudly. I don't know if that makes sense.
Yeah,
People
very
are saying-
quietly, loudly.
People are saying start getting your food together, getting your water together. Make sure you can stay in your house and live in your yard for at least a few months or a year. And I'm thinking to myself, some places like people in Guyana, yeah, I'm pretty sure there's some people in Guyana can do that.
Oh yeah.
Where they're just, just self-sufficient. They have everything. They have water, they have food source, they have everything that they don't even need to go out to get anything. And that's what the quiet, loudly voices are saying. Start getting your house together. Start getting food.
Start getting your house in order.
Yeah.
But the last time it happened, I was working in St. Martin.
Mm.
And when it came down, all the airports were shutting down. And I caught the last flight out of St. Martin.
Wow.
The last flight out of St. Martin.
Oh, you'd have been stuck.
Yep, I would have been stuck in St. Martin.
Wow.
And I didn't even know it was the last flight. After I boarded the flight, it was mentioned that this is the last flight.
Wow. Oh.
I didn't know. And I was heading to Fort Lauderdale, and that is where I ended up staying. I couldn't go anywhere. I couldn't get out of the US.
Everything was locked down.
That was it.
All flights, no flights, nothing.
Nothing happened. Everything was locked down. I was in Fort Lauderdale for over a year.
Wow.
I couldn't get out. Nearly 2 years.
Wow. So they're talking about that very quietly, loudly, and they're saying that if you can get a power source, get solar generators, something that you can get some power source from, because something along that lines, you need to get everything. So you need to be self-sufficient. Get your food, get your water sources, get emergency stockpiles of stuff. Medical, get a medical kit. They talking again about hydroxychloroquine, azithromycin, and zinc. There's a lot of those viruses are very, very, they're very responsive to those treatments. So you get a medical kit and get it together, and
get your immune system up.
Get your immune system up, exactly.
Get your vitamin C.
Mm-hmm.
Keep your vitamin C going. And there are many. We've got good sources of vitamin C in Guyana. We get a lot of fruits.
Mm-hmm.
There's a lot of mango, there's a lot of cherries, like pineapples.
It'd be interesting if people can. I mean, they have like those mangoes. Like, for example, you were telling me there's so much of them. They can get them and can them and
They can bottle the mangoes. They can
Bottle them,
freeze them.
yeah.
They can slice them and freeze them. We've done a lot of that. We slice them and we froze them because it's only there bountifully in season.
Yeah.
I have my mango tree in the backyard that bears a lot of mangoes. So we are blessed to have that. We got 2 cherry trees in the yard. We've got lemon.
A little bit.
we got lots of lemongrass that's there.
Lemongrass, yeah, you can make tea.
Yeah, a lot of lemongrass. So lemongrass is very, very, very good for fevers.
Yeah.
Very, very good for fevers. So lemongrass is one, and then we have a lot of lemon trees in Guyana.
It's good.
So we have a lot of bees that make honey. So you could make a very good antidote for the monkeypox by allowing your immune system to be enhanced to overcome an onslaught of attacks by viruses. So people need to, number one, they need to start becoming more aware of sanitizing themselves, get back into sanitizing seriously, washing your hands, making sure your shoes are clean before you walk into your house. Remember that was something that happened during the coronavirus year too?
Oh yeah.
That you left your shoes outside somewhere. It needs to start happening again. And it should happen continuously because you don't know what is on the road when you walk on the road. People spit on the road, they urine on the road, animals on the road, they mess on the road. There's so much happening on the roads that you don't know what you pick up when you walk, and then you walk into your house with the same shoes. So people need to start again sanitizing their shoes, leaving them in a certain area that is not where you dwell. You have to get back into those things. Very important. Act like if the situation is on top of you now. Don't wait for it to happen.
Let's say just be ready, prepared. It's better to be prepared than to be caught. I can't say surprised, but
if the CDC is coming out with those type of information.
The World Health Organization, WHO.
It's WHO. If the WHO is coming out with that, then the CDC soon enough will come out with something.
Well, it's interesting you said that because the CDC, a lot of studies are on the internet about some of the same things we're talking about. It's like a coordination,
Yep.
And, and of course, a lot of us don't read, so the information is right there, and we're not being apprised of it until it hits us, and then some of us are surprised and some of us are not. But yeah, it's a time to be prepared. I mean, we live in a crazy, crazy world right now. Very, very crazy. Things are happening before you can hear them. They're already happening. Before you become aware of them, they're happening. So we don't know. I wasn't expecting that the last time that this huge country, with all this information and knowledge, would be locked down like that.
One little virus.
One little virus, exactly. One virus. Knock it down.
We have a lot of mouth, We have a lot of mouth in different countries, but we don't have the guts. We don't have the guts to put in the place where people can reach it, the tools that they need to defend themselves. We come up with all of these things like a vaccine. Something they call a vaccine, not a vaccine, because a vaccine really should protect you from whatever it is that you're vaccinating against.
Not kill you.
But the coronavirus vaccines did not do that.
No.
They really were not vaccines because they came out too soon. And look at the end result. People are continuously dying.
Yeah.
People's bodies. I've spoken with people recently who would have told me that since they took the vaccine, they've never been the same again.
Yeah, and that's the other thing too. People become mentally somehow, personality changes, all sorts of things, man. It's an endless smorgasbord of things that are happening. I mean, I put it in food terms because a lot of people don't, they can go back to how they were. They were not sick. They didn't have any problems. The way they are now and everything. Every time when they do that analysis, they always come back to the very point of the time of vaccination.
Yeah.
Even the ones who were for the vaccine, the ones who were pushing people to get it. Now
the ironic thing is that everyone did not suffer the same type of things.
No.
There's so many persons who didn't have any effects, but I guess it was tailored to be like that because our DNAs are different.
Exactly.
Exactly. So it was designed to attack certain DNAs, I think.
Yeah. A lot of some people didn't have any well, let's put it this way, for now, because the scientists are saying, that they don't know the long-term effects on others, because some people, if you remember correctly, some people got it today and the next day they were dead. Some people got it and a week later they were having heart problems.
Yeah.
Some people got it.
Some people were paralyzed immediately.
Immediately, yeah. I could never forget, man. Oh boy, I don't know why he did that. The baseball player who was what is his name? He went and got it. Hank Aaron.
Yeah.
He was healthy, and there was nothing wrong with that man that I know of. And he just, because of the public, just for publicity, they asked him to go and just to show, because the black people at that time they were talking about the Tuskegee experiments. They said, "We're not going to be no guinea pig," in Atlanta. And they had him go on the television, and they showed him, and who else took the shot? Him and another person took the shot. They took the shot, just saying it's safe. I'm taking it. It's safe. 1 month later, after he went and got a booster shot, that was televised. A few weeks later, he was dead. Okay? Hank Aaron. Marvelous Marvin Hagler did the same thing. Did the same thing. And is it Marvin Hagler or Tommy? Who was it? One of the boxers.
Some of those.
It's one of them. I don't know. I'm thinking it's Hagler or Tommy Hearns. Was it Hearn? One of them went. It's on record. It's on YouTube. He went and took it, and a few months later, not even quite a month, he died. Now, I'm looking at all that. What do you think I should think?
We got 2 more minutes, Dr. Richard.
Oh. So, so the thing is, we have to ask God for wisdom, man, and discernment. That's all. Because we're living in those sort of times, because they're talking about having a vaccine for this Mpox too, and trying to make it like they did COVID.
Yeah.
So you can't work, you can't fly, you can't go anywhere without having it. That's where they're heading. That's what they want to do. But
there's always a mission that they're on, and they will always find a method to accomplish the mission.
Mm-hmm.
But we have to be wise as humans to those persons who want to take us on those missions. We have to be wise and sensitize ourselves and look at the benefits or the negatives.
Mm-hmm.
And if the negatives outweigh the positives, then we need not involve ourselves.
Yeah. And every individual have a choice, you know, and I ask people why they get it, and they always say, well, you know, I couldn't go to work,
I
or
couldn't go to work. I lost my job.
uh,
You know, I couldn't travel. I couldn't go.
understand that.
I couldn't go to the bank. I couldn't. You know,
Yeah,
they made it so that you had to get it to get things done.
yeah,
Yeah. But let's see what will happen now. Let's hope that
yeah.
that since time is up on us, pretty much. Let's hope that good sense will prevail, and the people will get their immune systems up and
That's
eat
right.
smarter, eat healthier, and make better decisions with their health.
Mhm.
You know, but the clinic is closed and will not be open until September 3rd. Not because of any reason, but because the staff needs to take a break. They were tired, and we need them to be, you know, strong and healthy and ready when we reopen on the 3rd. So if a person needs an appointment, they can call, leave a message with a number, and a call will be made back to them. But my advice to everyone now is to work on your immune system and make sure that the children's immune system is also worked on. Any final words, Dr. Richard?
Yeah. I affirm what you're saying. I mean, the kids are getting ready to go back to school, and it's about the same time, very similar timing. You know, work with them, help them. You know, and to use natural things to build the immune system and eat healthy. Yeah.
Okay, well, we're at the end of our program, and I want to thank those of you who are watching. We hope that you learned something and that you wouldn't be alarmed, but take your health seriously. And we'll be back on the air next Thursday. I should be, if not, maybe Dr. Richard can do it. I'm probably working in New York next Thursday. But until we are able to get back together again, we wish you good health. Be smart, be sensitive, grow your own foods, and eat out your own kitchen.
That's right.
You know, so Dr. Haynes or Dr. Richard, I want to thank you for being a part of our program today, and as usual, continue the good work in trying to save as many humans as we can.
Yes. Yeah, prayerfully. Yeah.
Okay?
Thanks for the invite.
Until we get together again, you have a wonderful weekend like everyone else. Take care of yourself, and so long.
Same to you. Same to you. Thank you for listening.
Okay.
If you or someone you know is sick, have tried to get help, and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today at 72 Queen Street, Kitty, or call us at 231-6477 for further information.